John.
Hey, Cecilia.
I didn't know you smoked.
Yeah, I try to keep it quiet from the instructors and stuff because I know we talk about smoking, but
Oh, man. When did you start that?
about 5 years ago. Yeah, and I started, it's gotten worse at school, you know.
Yeah.
And I really started school about 5 years ago because I never been to school. So, don't tell anybody.
How do you feel about this exam?
I don't know. I don't know how to feel about this thing. I mean, what are some of the things that you're thinking is going to be on there?
Well, do you know about nitroglycerin?
Nitroglycerin? Is that like something to do with like sugar or glycerin, kind of? Or like explosive?
No.
Oh God.
All right, well,
Really?
I'll see you in there.
No. Jesus. I'm feeling rough.
Hey, John.
Hey, how you doing? How are you ready for this?
Mm-hmm.
Hey, Brett, how you doing, buddy? Woo! Hope you're doing good, pal. You said he had time to study. I
Oh,
don't know
sit
if I
down.
did.
Your breathing's crazy.
I know. I feel like my chest. I got pressure, like an elephant, or something.
It's gonna be okay. We're gonna
I
get
gotta
through
get
this.
oxygen in me. I'm having a little pain.
Uh-oh.
I've never had this before. It's stress.
Just take some deep
Okay.
breaths. It's gonna be okay. We got this.
Breathe through the nose. That's what they told us, right?
Mhm.
Okay. All right. Okay. Let's try this here. I guess we're
Okay,
gonna-
everyone quiet. Test is starting.
Okay, here we go. Number one. Oh God, these are crazy. A 46-year-old man presents with diffuse macula poop. Oh jeez, macula poop. Oh God, a rash. He has a history of hypertension for which he takes the following 15 medications. Okay, guanabazin. Oh God, guanabins, nefepine. Oh, I don't know. Verapamil. Okay, verapamil. I got that one. Diazepam. Forget the meds. Oh my God. Okay, okay. Assuming there are 7 monkeys on the roof. I can't believe this. 1, 2, 3, 4, 5. Okay, 7 monkeys on the roof, and 2 in the monkeys in the garden. 1, 2. Okay, what the heck do monkeys? Oh, have to do with this on my chest. What is the second enzyme required to make the color purple? Monkeys. What the heck does oh God, Cecilia's already doing math. That means I'm way behind. Brett, I think Brett's done. He's looking out there. Oh God, she's on math already. Monkeys, the color purple. Monkeys, the color purple. Monkeys on the roof. Okay, monkeys. What do monkeys do? They eat bananas. Okay, bananas. Calcium. Okay, no, not calcium. Potassium. Monkeys eat potassium. Okay, so that means he could be hyperkalemic. Okay, the enzyme. Okay, what would be an enzyme? The color purple. I don't know. I don't think I can. Oh my gosh, I'm starting to get dizzy.
Oh my God,
monkeys.
John! I'm gonna get him to the hospital. Someone help! He's having chest pain.
Okay, he needs to rest. Okay, go ahead and have a seat. Move! Stat, I need.
I'm hurting.
Okay, patient in room 311 coming in for a suspected MI.
Right.
So I want a 12 lead. We're gonna do Mona. I want 12 lead. We're gonna do Mona. I want morphine 2 milligrams every 5 minutes for the next 15 minutes. Nitro sublingual and an aspirin. I want a blood draw, CBC, CMP. Then I want the cardiac enzymes, CKMB and a troponin. Order a chest x-ray, give me some vitals, and do a TEE.
Of course. All right. Sounds good.
Thank you.
Hello. My name's Allie. I'm going to be your nurse,
Hi.
trying to help take care of you. Can I have you state your name and date of birth for me?
This is John Salmon. It's 1/24/56.
Okay,
My chest
very
is hurting.
good. Okay. Tell me about that on a level 1 to 10. How much?
About an 8. It hurts
Okay.
bad.
What kind of, is it a burning, stinging, sore,
It's like
heavy?
a pressure, and
Okay.
it goes down my arm
Oh, okay.
and my neck.
All right. Yep. Got a 7. So I'm going to go ahead and put some oxygen on you.
Okay, thanks. Oh,
Yeah,
thanks.
no problem. Let me get this.
Oh, I know that'll help. I've learned that.
Okay, just a little right in there.
Oh, I never thought this would happen to me.
I know. But we're gonna go ahead and do some teaching real soon and figure out the cause. Okay. All right. Well, I just gotta. Do you have any allergies or anything?
No,
Allergic to anything?
no allergies.
Okay. I'm just gonna do a couple listening here and there. All right, and you can go ahead and take a deep breath. Okay. Okay. All right. Okay, sorry. Alright. Just gonna make sure that. Okay, yeah. Yeah, your heart rate's at a pretty high right now.
It feels fast.
Alright, I'm gonna go ahead and
Alright, John, I called your wife, Mary. Will you let her know what's going
Thanks.
on?
It's hurting
Are you
worse.
Should I call the nurse?
It's getting worse. Oh,
Oh my god, John! John! John!
Code blue, room 311.
I just saw his telly and I was
Code
coming in.
blue,
What's going on?
room
I think he's having a heart
311.
attack.
Okay, yeah, his pulse is gone. Let's start compressions. Doctor! Is there a pulse?
Ready?
No. Okay.
Push 1 of epi.
John?
John.
Pushing the epi now.
Okay.
Okay, we're gonna
Still no
shock.
pulse. Okay, clear.
Everybody clear? We gotta get him to the cath lab.
Right away.
what happened?
He's totally occluded, and he's been having symptoms intermittently for the last couple of days. So we're going to open up the right coronary artery. He's had, looks like a little bit of damage to the bottom part of the heart, which you see in this picture here. And that's the part of the heart that's supplied by the right coronary artery. So this gentleman has an occluded right coronary artery, which is likely recent. His last prolonged episode of chest discomfort was today. So he's having ongoing discomfort. He has a damage to the inferior or bottom wall of the heart, which suggests that he's in the process of having what we call a myocardial infarction or heart attack. The left system looks fine. So we are going to go ahead and open up the right coronary artery. So what we're first going to do is we're going to access the right coronary artery with a special type of a catheter called a guiding catheter. Place a wire across the blockage and then pass a catheter that will remove clot from the vessel. In patients who have acute coronary syndromes or acute heart attacks, these are from clot and plaque. And so to make the artery ready for the stent, we need to withdraw some of the clot. So we're going to do that with a specialized catheter first. Right now we're placing a guide catheter into the right coronary artery, which is occluded. So on the bottom screen, we're going to show the vessel as it is now that I could use for a road map, and then we're going to improve that vessel to normal. So the first thing we need to do before we place equipment into the artery is place a wire, manipulate a wire across the blockage in order to place all of our equipment. So we have a wire going into the artery here. Okay, so we've gotten the wire across the blockage. What we're going to do is place this catheter beyond the blockage if possible. And then through the catheter, with negative suction, attempt to remove the clot that caused this artery to block suddenly this morning. And then we'll take a look at the artery and see how it looks once we do all that. We're going to take a quick shot after the export catheter has been passed. Go ahead.
Question is, do you want the card?
All right, so the artery's open.
Cecilia called me. She had to go home and study for a test.
Oh.
So I came as quick as I could.
I understand those tests. I'm so glad you're here, honey. Thanks for being here.
Hi, I'm Dr. Alicia.
Hello. I'm
Allie.
Allie, the nurse.
So he just came back from the cath lab. So basically what happened is we saw some ST elevations on his strips, and basically that's sudden ischemic death of myocardial tissue, and it's usually from an occlusion of the coronary arteries, and it was from a buildup of plaque, atherosclerosis, and so they placed in a stent, and that should help.
Feeling a little better.
Okay, that's good. We're going to be doing a good plan of care. We got some good teaching things. I'm going to go over and ask a couple of questions. Is that okay with you right now?
Sure, yeah.
All right, doctor, are you good? Are you going to
Yep,
stay
if you
here?
have any
Okay.
more questions, just let me know.
Thank you,
Okay,
Doctor.
thank you, doctor.
All right, so while we have some time with you, I just wanted to find out, before this event, what was your activity level like? Did you exercise much?
I used to exercise and go to the gym, and then I started nursing school, and I had to stop pretty much everything. It was just study and study, and I haven't been able to do that much.
Yeah, okay. Also, what kind of diet are you following right now, if any?
I used to eat good, and again, then I had nursing school, and I have to, when I'm on my way to school, I'll stop at McDonald's or something just to get food because I gotta get here. It's not that
Okay.
good, not like it used to
Yeah.
be.
Yeah, well, we'll get that figured out soon. We'll get a good nutrition
That's good.
nutritionist. She'll come in and we'll discuss all that with you. And what are you smoking at all? Using tobacco?
Yeah, I have to admit I am. About a
Okay.
pack, just a little used to be, but now with all this stress and clinicals and tests, I'm about up to a pack or so a day, more maybe.
Okay. Yes, I understand stress can be a lot, and maybe we can talk about alternative ways of dealing with that.
Okay.
But all those things that you mentioned to me about having a lot of stress, using tobacco, your poor diet, and lack of exercise are all things that are going to make this happen again. And we need to work on those, because those are things that we can change, and it will inevitably help you to succeed in not having this happen again. Okay?
Okay.
All right, I'm gonna go ahead and get together some teaching supplies, and we'll go ahead and talk about that when I get back, okay?
Okay.
All right.
All right, okay.
Hi, John.
Hi.
I'm Maria with Diet
Maria.
Terry. I'm gonna come over and help you pick some foods for breakfast and lunch tomorrow.
Okay.
You were placed on a cardiac diet, which
That makes
means
sense, yeah.
you're gonna go with low sodium foods,
Mhm.
as in fresh vegetables and fruits rather than canned goods.
Yeah.
And then also low cholesterol, so that's gonna be your lean meats,
Mhm.
grilled, not fried,
Okay.
and no bacon. Alright?
Okay.
So would you like eggs tomorrow and some fresh fruit and yogurt?
Yeah, that would be good.
Okay, sounds good.
Whatever you think's the best, you know.
Alright, thank you.
Okay, John. Hi.
Hi.
I'm back. I'm
Good
just
to
gonna
see you
do.
again.
Yeah, good to see you. And I hope you're feeling a little better
A
now
little
that
better
we've
now.
got
yeah.
you some.
I guess it was pretty bad.
Yeah, it was. So basically, I just want to go over some of those points that we mentioned earlier, and I think it's good that you're here because you're going to be at home with him, and I want to make sure everybody understands what we can do to promote his health. Okay, so as we talked about your smoking, and that reminds me, we are going to get your discharge papers put through. I just spoke to the doctor. And I believe the doctor is we're going to do some kind of prescription with maybe a nicotine patch to help you quit smoking
Yeah,
altogether.
I need to stop.
Yeah, it needs to.
Yeah, I gotta stop.
That's one of the number one things that we
Yeah.
can do to
I know that.
get the
If anybody,
results.
I should know that.
Yeah. So, but it is hard, and everybody knows it's not easy. It's something a lot of people have an issue with. So another tip is just maybe have some mints lying around. So if you feel that antsy moment, you need something, just have a mint instead, you know. Also, I wanted to go over how you deal with stress, and right now that's through smoking cigarettes or eating some junk food or something. Maybe instead, when you're having a stressed out moment and you have a big test coming up, do you like classical music or just something?
She's even told me to do
relax?
that. Mary's told me to.
Yeah, Mary, you could
She
do
sees me stressing
some
all
guided
the time.
meditation. You guys could do some of that together. Even some yoga or something.
Yeah, she does yoga.
Yeah, so
Yeah.
that would be something to look into. Talking of yoga, some kind of moderate exercise is really something that will help improve your issues right now. Maybe 3 to 5 times a week, but we really don't want you, we want you to be able to hold a conversation during that exercise. We don't want you to get out of breath, because you don't need to push yourself
Right.
too much. This isn't time to start any strenuous exercise
Yeah, I
plan,
get it.
you know,
Yeah.
huffing and puffing. We just something calm and just to get you moving, you know. This will be really good for you. So I can go ahead and get a couple pamphlets together, just something for you guys to take home, and I'll wrap it all up, and I'll go see how the discharge papers are going together. Okay.
Okay.
All right. Thank
All
you.
right, thank you so much.
Hi guys, how are you doing?
Hi,
How are you
doctor.
feeling?
Feeling a little better now.
Okay, well,
Yeah.
since you're feeling better, we're gonna go ahead and discharge you home. But I have
good.
some prescriptions here I want to talk with you about
All right.
that you're gonna have to take from
Okay.
now on. Okay.
Okay.
So the first medication I'm gonna put you on is a cholesterol medication.
Mhm.
This is to keep your cholesterol
Okay.
at a good level, so you don't have any buildup of plaque again,
Yeah,
which is what
yeah.
caused that. So it's gonna be simvastatin, and we're gonna pair it with a healthy diet as well.
Okay.
So you gotta do that heart healthy diet like
Yeah,
Maria told you
yeah,
about.
Okay.
And
No McDonald's.
No McDonald's.
Oh, man.
Okay,
That'll
so
be
we're
hard.
gonna do some frequent blood work with this about
Yeah.
every 6 months.
Okay.
Just so that we can keep track of your liver function, your cholesterol levels and stuff. And the second medication I'm gonna put you on is a beta blocker called
Okay.
metoprolol.
Okay.
And what this is gonna do is gonna control that heart rate and the contractility of your heart.
Yep. Yep.
Okay, and it can lower your blood pressure and your heart rate, so just watch out for orthostatic
Yeah, I
hypertension.
get up and stuff.
You know what that is from nursing
you're
school.
saying. Uh-huh.
And you're gonna have to monitor your heart rate with this.
Yeah.
And if it gets around 50, you're gonna go ahead and hold it and give me a call, and we'll see
Okay,
what we're
I
gonna do with
remember that question. Yeah.
Okay, and the ACE inhibitor we're also gonna give you.
Good.
This reacts with angiotensin, you know what
Yeah,
that is from
yeah.
nursing school. Okay, and this is also gonna vasodilate your vessels, gonna keep your blood pressure under control. And if you develop a cough, known as
Yeah.
the ACE cough,
Yeah.
you're gonna go ahead and call a doctor. We're also gonna give you some aspirin.
Mhm.
Most people think this is a blood thinner, but it's not actually
Okay.
thinning your blood,
Yeah,
and it's
okay.
not an anticoagulant.
All right.
What it does is it causes the platelets to be slippery,
Uh-huh,
so that way
okay,
it's going to
yeah.
prevent a clot. And it's going to be a low dose aspirin, not like
Okay.
you take for pain. And take this with food
Yep.
to doesn't cause upset
Okay,
stomach.
Yep.
And I'm also going to give you nitroglycerin as needed. This is
Mhm.
going to be for the chest pain.
Yep.
So you're going to take 1 sublingually
Okay.
on the onset of chest pain.
Yep.
Okay, and then rest if you feel
Mhm.
chest pain. If
Okay.
it doesn't go away in 5 minutes, you can take it 2 more times, 5
Okay.
minutes apart. And if after that you're still feeling chest pain, you're gonna call 911.
Okay. Yeah. I
Okay,
know. Yeah.
so
Makes sense.
you're gonna keep this in an amber bottle that it's gonna come in, and you're
Uh-huh.
gonna have to replace it every
Okay.
3 months.
All right.
Okay.
You have to watch that. You know me. I'll forget that stuff.
I'll take care of it.
I also filled out a prescription for a nicotine patch so that we can
Okay.
get you to quit
Good.
smoking. Your
Good.
nurse talked to you about that.
Yep. I need to
Okay.
stop.
Do you have any other questions for me, either of you?
No. Do you have any, Mary?
No, I don't think so,
Okay.
but thank you.
All right. Well, I hope
Great.
you get to
All
feeling
right, doctor,
better.
thanks for helping me. I
Thank
appreciate
you.
it.
Give me some vitals and do a TED.
Of course.
Thank you.
What did she just say? Who cares?
We're gonna put Brent. This is Brent.
Hey, Brent.
Hey, Brett.